Welcome to the OET Rx Foundation course lesson 8 of 27, Reassuring an Anxious Patient. I'm Tawakkoli, and in this session we'll focus on a skill that often makes the biggest difference in patient outcomes: how you respond to anxiety. We will learn how to spot verbal and non-verbal signs of anxiety and how to use empathetic, validating language to build trust quickly. We will also practice giving clear, honest reassurance, supportive but realistic, so you avoid false promises while staying helping the patient feel safe and understood and being professional. Finally, we'll look at how to structure your consultation to reduce fear and uncertainty step by step. Let's get started. Section 1. Why reassurance matters in the OET. در آزمون OET توانایی شما در برقراری ارتباط با بیمارانی که معمولا نگران و مضطرب هستند نشون دهنده بلوغ حرفه شماست. ممتحنان این وسط چی؟ میخوان ببینن که آیا شما میتونید فضای امنی برای بیمار ایجاد کنید و به اصطلاح ترس‌های اون رو جدی بگیرید. In the OET speaking subtest, examiners look for your ability to establish rapport with anxious patients. Simply rushing through medical facts is not enough, is not ideal. You must demonstrate empathy, validate their feelings, and provide reassurance that is based on facts, not empty promises. Okay? For example, instead of saying, "Don't worry, it's nothing serious," a higher scoring candidate might say, "I can see that you're very worried, and that's completely understandable given your family history. Let's go through the details of the procedure together so you know exactly what to expect." Okay? خب دقت کردین؟ Notice how the second sentence validates the patient's emotion. "I can see you are worried," and offers a concrete solution. Go through the details, which is far more effective than dismissing their fears, یا به اصطلاح رد کردن اون ترسشون. اوکی؟ خب میرسیم به بخش دوم. Section 2. Essential reassurance vocabulary. برای اینکه تو وقتمون صرفه جویی بشه و بیشتر تمرکزمون روی کاربرد واقعی این لغات باشه، من مهمترین واژگان این درس رو انتخاب کردم و با مثال‌های پیشرفته‌تر میخوایم اونا رو بررسی کنیم. دقت کنید که واژگان خوب و مرتبط هر حوزه‌ای رو شما داشته باشین مستقیما روی 2 معیار نمره‌دهی شما تأثیر داره. یکی معیار interpersonal skills و یکی هم lexical resources. اوکی؟ روی مهارت‌های بین فردی، یعنی واقعا مهارتی که شما ارتباط میگیرید با همکار و یا با بیمار، و روی منابع واژگانی شما یا lexical resource شما تأثیر بسیار زیادی خواهد داشت. خب اولین واژه ما validation هستش که بسیار پرکاربرده. من خودم هم از فعلش هم از اسمش مکرر استفاده میکنم. به عنوان مثال، your concern about the side effects is perfectly valid given the severity of your symptoms. Anxiety. The patient exhibited. به جای چی؟ به جای به عنوان مثال showed, represented میتونیم از exhibited استفاده کنیم. The patient exhibited heightened anxiety during the discussion of the surgical risks, requiring additional time for explanation. Determine. We need to determine the underlying cause of the pain before we can consider any invasive procedures. Empathy, okay? Showing empathy involves acknowledging the patient's distress, آشفتگی و نگرانی بیمار, okay? Without necessarily agreeing with their misconceptions, okay? Reassurance. Clear and consistent reassurance is often more effective than technical jargon when managing patients' apprehension. apprehension هم که جا میدید معنی نگرانی داره. Active listening. Through active listening, I was able to identify that her fear stemmed, یعنی ریشه گرفته. Her fear stemmed not from the procedure itself, but from a previous negative experience with sedation. Okay? خب بریم سراغ سکشن بعدی، قسمت بعدی High Scoring Communication Phrases. در این بخش با عبارت‌های حرفه‌ای آشنا میشیم که در اسپیکینگ و رایتینگ OET به شما کمک میکنن طبیعی، همدلانه و حرفه‌ای صحبت کنید. Okay? اولین عبارت مربوط به acknowledging anxiety هستش، تصدیق یا پذیرش اون نگرانی. به چه صورت میتونیم از این مثال استفاده کنیم؟ I can see that this news has upset you and it's perfectly normal to feel anxious right now. مرحله بعدی، عبارات بعدی مربوط به validating feelings هستش. به چه صورت؟ به این صورت I understand why you might feel that way, especially given your father's experience. Offering detailed explanation. Let me walk you through the procedure step by step so there are no surprises. Reassuring without false hope. Reassuring without false hope. While I cannot predict exactly how your body will respond, I can tell you that we have a strong plan in place to manage any side effects. Okay? اینجا in place معنی موجود داره. Okay? Checking understanding and comfort. Does that explanation make sense? Do you feel more comfortable with the plan now? Okay? خب بریم یه مثال رایتینگی هم مرتبط با حوزه نگرانی بیمار با هم داشته باشیم که معمولا در رایتینگ اون میتونیم به خوبی ازش بهره ببریم. به عنوان مثال The patient expressed significant anxiety regarding the upcoming procedure. Therefore, a detailed consultation was conducted to address her concerns and provide necessary reassurance. خب میرسیم به سکشن بعدی، بخش بعدی. میخوایم از یه تکنیک خوب برای اعتبار بخشی استفاده کنیم. The validation technique. Okay? یکی از مهمترین ابزارها برای کاهش اضطراب بیمار همین validation تکنیک هستش. The validation technique is one of the most powerful tools for reducing patient anxiety. که من این رو در چند مرحله یا چند استپ براتون توضیح میدم. Step 1. Acknowledge the emotion. Acknowledge the emotion. Okay? به چه صورت؟ I can see that you are feeling very worried. Step 2. Normalize the feeling. به چه صورت؟ It's completely normal to feel anxious before a major procedure. Step 3. Validate the specific concern. I understand that your father's experience makes you fearful of the sedation. Step 4. Offer support and information. However, the techniques we use today are very different and much safer. Let me explain how we ensure your comfort. Okay? By validating the patient's feelings, you show that you're listening and that their emotions are respected, which builds trust and reduces defensiveness. خب واقعا اون دفاعی بودن بیمار رو کم میکنه و اعتماد بسیار قوی و خوبی رو ایجاد میکنه. Section 4. Providing clear reassurance. ارائه اطمینان خاطر که باید شفاف و مبتنی بر واقعیت باشه و نه وعده های غیر واقعی. Okay? Providing reassurance must be clear and fact-based, not based on false promises. Avoid saying, "Don't worry, everything will be fine." This is vague and dismissive. Okay? This is vague and dismissive. Instead, say, the procedure is very common and we take every precaution to ensure your safety. I'll be with you throughout the entire process. Use phrases like, my goal is to help you through this and we will take it one step at a time. We will monitor you closely and if you feel any discomfort, we will stop immediately. You are in control and we will not proceed until you feel ready. خب بریم سراغ سکشن بعدی، سکشن 5 Managing Specific Fears. بیماران میدونید که ممکن ترس‌های خاصی داشته باشن، مثلا چی؟ ترس از درد، ترس از بیهوشی یا حتی ترس از تشخیص بد و اشتباه. Patients may have specific fears such as fear of pain, fear of anesthesia or fear of a bad diagnosis. خب چطوری ما اینا رو رفعشون کنیم این ترس ها رو؟ For example, for the first one, addressing fear of pain. Addressing fear of pain. رفع و یا رسیدگی به ترس از درد. به عنوان مثال, we will use effective pain management techniques to ensure you are comfortable. You won't feel any pain during the procedure. Okay? Addressing fear of the unknown. Addressing fear of the unknown. I will describe exactly what will happen from the moment you enter the room to when you wake up. Knowing what to expect can help reduce anxiety. Addressing fear of bad news. I know you're worried about the results. We are doing these tests to get a clear picture so we can help you best. Whatever the results are, we'll have a plan to support you. بریم با هم یه بریک داشته باشیم، به فایل لیسنینگ گوش کنیم. تستش رو قبلا زدین، حالا میایم ترانسکریپتش رو با هم بررسی کنیم. And I'll be back very soon.
Good morning. Today's topic is one we all deal with daily, the anxious patient. This is particularly common in physiotherapy, where patients are often in chronic pain and worried about their future mobility. Now, when you're faced with a patient experiencing significant anxiety, your first instinct might be to jump in with reassurance, saying things like, "Don't worry, everything will be fine." But this can sometimes be counterproductive. The first thing we must do, and this is critical, is to try and determine the root cause of the fear. The anxiety itself is a symptom. You need to find the diagnosis. Are they anxious because of the pain? Are they worried about the cost of treatment? Are they afraid of losing their independence? Without understanding the why, your reassurance will be generic. So your first step is always to ask gentle, open-ended questions like, "I can see this is worrying you. Can you tell me what's on your mind?" Only then can you tailor your reassurance effectively.
خب پاسخ این تست رو هم میدونید. Identifying the underlying reason for the anxiety. The speaker explicitly, صراحتاً, the speaker explicitly states that jumping into reassurance can be counterproductive and that the critical first step is to determine the root cause of the fear. خب در بخش بعدی section 7 OET Writing Strategy میایم استراتژی بسیار خوب در رایتینگ با هم بررسی میکنیم. مایند مپینگ. قبل از اینکه حتی یه جمله بنویسیم باید ساختار ذهنیمون رو بسازیم. Before writing a high scoring OET letter, your brain needs a structure. خب خیلی از داوطلبا چی کار میکنن؟ مستقیما وارد نوشتن میشن. Many candidates jump straight into writing. نتیجه what is the result؟ نامه پراکنده، تکراری، نامنظم و در نهایت از دست دادن نمره. Disorganized, repetitive letters and ultimately a loss of marks. Mind map چی کار میکنه؟ یعنی چی؟ mind map یعنی شما قبل از نوشتن مسیر نامه رو طراحی میکنید. Mind mapping means you design the path of your letter before writing. نه طولانی, not long, نه خیلی پیچیده, not complex. فقط یک نقشه سریع, دقیق و هدفمند. Just a quick, accurate and purposeful map. خب امروز یاد میگیریم چطور در کمتر از 5 دقیقه یه مایند مپ حرفه‌ای برای OET رایتینگمون بسازیم. Today we'll learn how to build a professional mind map for OET in less than 5 minutes. A mind map is not decoration. It is a thinking tool. Its purpose is very simple. To organize relevant information clearly before you start writing. Let's build this strategy step by step. Step 1. Write the purpose in the center. take your paper. In the center, write one short phrase. For example, referral for assessment, or discharge with follow-up care, or transfer for rehabilitation, request for community support. Okay, this becomes your anchor. Every piece of information must connect back to this central purpose. If it doesn't connect, it doesn't belong. Step 2. Create 3 core branches. From the center, draw 3 main branches. Background, current situation, action, or request. Okay? These 3 branches match the natural structure of most OET letters. Now place relevant case note details under each branch. Okay? Step 3. Fill each branch strategically. Under background, include diagnosis, important medical history, previous interventions, only if relevant, of course. And under current situation, include present symptoms, current treatment, clinical findings, immediate concerns, and under action or request, include what you want the reader to do, follow-up plan, monitoring instructions, specific support needed, and notice something important. Okay, you are not copying the case notes, you are categorizing them. This mental organization prevents repetition and confusion. Step 4. Remove overlap. Look at your mind map. If the same idea appears in 2 branches, decide where it belongs. Each detail should have one clear possession. Clarity in planning creates clarity in writing. Step 5. Check logical flow. Now ask yourself, if I write this branch as a paragraph, will it flow naturally? Does the background lead logically to the current condition? Does the current condition justify the request? If the answer is yes, your structure is strong. Why mind mapping increases your score? A structured plan improves first cohesion and organization, relevance of information, and paragraph clarity, as well as confidence under time pressure. Candidates who skip planning often repeat information, forget key details, write disorganized paragraphs, run out of time. A simple mind map prevents all of this. A practical example for you, let's imagine your task is something like that. Referral to a physiotherapist for post-operative knee rehabilitation. Okay? Your mind map might look something like that. In the center, referral for physiotherapy rehabilitation, branch 1, background, total knee replacement, 2 weeks ago, osteoarthritis history, and branch 2, current situation, limited mobility, pain score 6 out of 10, difficulty weight bearing, and branch 3, action, assess mobility, design rehabilitation program, improve strength and flexibility. Okay, clear, focused, logical. Okay, that's all you need. All right, let me give you a homework. Take a fresh OET case note. Don't write the letter. Instead, write the purpose in the center of your page. Create 3 branches: background, current situation, and action. Add only relevant information under each. Review and remove any unnecessary detail. And time limit 5 minutes. Train yourself to think in structure before you write in sentences. In OET writing, structure is not optional. It's the silent foundation behind every high-scoring letter. Okay, now let's move on to section 8, speaking task preparation. در بخش اسپیکینگ OET شما ممکنه با سناریوهای مختلف روبرو بشید که نیاز به اطمینان بخشی داره. در اینجا 2 نمونه رایج رو با هم بررسی میکنیم. در هر سناریو شما باید تکنیکایی رو که در این درس یاد گرفتیم مثل اعتبار بخشی validation، توضیح دقیق detailed explanation و یک لحن همدلانه رو استفاده کنید. In the OET speaking subtest you may encounter various scenarios requiring reassurance. Here are two common examples. In each scenario, you should use the techniques we'll learn in this lesson, such as validation, detailed explanation, and empathetic tone, okay? Task 1, the endoscopy scenario. Scenario is something like that. A 42-year-old patient who you have just told needs an urgent endoscopy to investigate persistent stomach pain. The patient becomes visibly anxious, stating their father had a terrible experience with the same procedure years ago, and they are afraid of the sedation. And your task is acknowledge the patient's anxiety and validate their concerns based on their family experience. Gently explore the details of their fear, provide reassurance by explaining how the procedure and sedation methods are different and safer now. Describe the process in detail to demystify it. Reassure them of your support and that you will not proceed without their full comfort and consent. Okay, let's review a sample answer, a high score sample answer. Okay, you can start something like this. I can see that you're feeling very worried, and that's completely understandable, especially given your father's difficult experience. It's normal to feel anxious about sedation and the unknown. Let me try to put your mind at ease. The procedures and sedation techniques we use today are much more advanced and safer than they were years ago. You will be given medication that helps you relax deeply, and I will be monitoring you closely throughout the entire process to ensure you are comfortable. You are in control, and we will stop if you need a break. Does knowing that I will be with you every step of the way help reduce some of your worry? Okay? So let me give you another task. Okay, task 2. The diagnostic test scenario. A patient is waiting for biopsy results and is afraid it might be cancer. Okay? They are trembling and having difficulty speaking. And your tasks are acknowledging their fear, validate their feelings, explain that while waiting is difficult, it is necessary, of course. Offer coping strategies, reassure them of your support regardless of the outcome. Okay? And let me give you a sample answer, a high score sample answer, of course. Okay? You may start something like that. I can see that this waiting period is very difficult for you, and it's completely normal to feel afraid while waiting for results. Your fear is understandable. While we wait for the results, I want to make sure that you are coping as best as possible. Will it help if we discussed some relaxation techniques like deep breathing to help manage the anxiety? Please know that regardless of what the results show, we have a plan to support you, and you are not alone in this. I will call you as soon as the results are available. Okay, let's move on to the last section, lesson summary. خیلی خوب پیش رفتید تا الان و حالا به پایان درس 8 رسیدیم. Today we focus on how to reassure an anxious patient in a way that is both professional and empathetic. We reviewed essential vocabulary related to anxiety and empathy, practiced the validation technique, and explored how to offer reassurance that is clear, honest, and supportive without giving false hope. We also looked at how to reflect patient concerns effectively in OT writing to demonstrate holistic care, and how mind mapping can help you organize your ideas more clearly. And for practice, try recording yourself reassuring a friend who feels worried about a medical test. Pay attention to how well you validate their feelings and how clearly you provide factual, calming information. Thank you for completing lesson 8 of the OET Rx Foundation course. Keep reviewing the vocabulary and communication strategies from this lesson, and I'll see you in lesson 9. All the best. Until then, have a good time. Bye for now.